first question is that what is the therapeutic potential of some popular anti-aging substances such as rapamycin in the neurodegenerative diseases, or some common anti-aging methods such as caloric restriction? Is that beneficial for preventing Alzheimer's diseases? Or
yeah, it actually turns out that there have been studies in several Alzheimer's and Parkinson's models that, including a publication from our own lab in a genetic Parkinson's model, that suggest that rapamycin is something that is of benefit. Again, there are development of things called they're compounds that may be structurally related to rapamycin, but have less toxic side effect and or more effective. Caloric restriction as well. People like Mark Metzen at the NIA have done studies where they've shown that caloric restriction is something that helps in terms, or is possible, like therapeutic for PD and AD. I mean, one of the issues with its use in Parkinson's disease is people with PD, when it's sort of full blown, they actually experience a lot of weight loss. So I think what's important about caloric restriction is a lot of science has been used in the last decade or so to try to understand the mechanisms by which caloric restriction is driving these and its beneficial effects in aging and a lot of chronic age-related diseases, to see if we can come up with drug mimetics of that. One of those might be metformin, which is currently being assessed as well, but used in testing in older, otherwise sedentary individuals. So I think it's really cool, because I think it's kind of this advent of, up until now, we've kind of studied disease in silos, but over the last 15 years ago, scientists had this epiphany, realizing, wow, there's probably aging is not just a risk factor, but there are these common underlying processes like cellular senescence or mitochondrial dysfunction that are really contributing to these very different diseases. So if we can find a way to, for example, eliminate senescent cells, that's going to be useful in a lot of different age-related diseases. It's just making sure that we are not causing toxic side effects, and that's part of the game.
Sports or other activities or sleep. How much an impact does sleep and other activities have on these neurodegenerative diseases?
So exercise, very important. As I had mentioned, with Parkinson's disease, doing high intensity exercise has been shown with Parkinson's disease. It's actually has a pretty amazing effect. And so I think, yes, things like exercise, very important, and also staving off these other comorbidities that occur with aging that may contribute, like diabetes and et cetera. Sleep. This is something that's very, very important. And again, I think like the dietary restriction in the last decade or so, people realizing that maintaining your circadian rhythm and appropriate sleep is really, really important for your overall health when you're aging. I mean, ironically, people tend to have more trouble with sleep as they get older. But you know, things like exercise can help with that. Yeah, very important part of health.
Then what are other diets or supplements are beneficial for preventing brain aging? Can coffee help when it comes to
I
food or drink?
Yeah, it seems like the rules with this change all of the time. But certainly recent studies have suggested that coffee um, is beneficial, and other, you know, proteins, nuts, etc. It's interestingly, there have been epidemiological studies done, and drinking coffee actually has been found to reduce your risk of Parkinson's disease. It's one of the things that, you know, so coffee in terms of Parkinson's risk, consuming coffee reduces it, but it's probably sort of a bell-shaped curve with everything in moderation, because of course taking a lot of coffee can impact on your sleep. So you know, getting a dosage, getting a certain dosage. I think the recommendation now is like 2 cups a day, something like that.
Well, a rather professional audience has raised a question that recently the FDA have cleared lecanemab for entry into approval, which is the first beta-amyloid directed antibody to move from the accelerated to conventional approval. Then are you optimistic about this drug? Do you think it is promising?
I actually do. I mean, I actually do think it's promising. We've had 20 years of clinical trials with these A beta um, immunotherapies, which have not shown improvement in cognition. With lecanemab, it's really the first one where it's been shown to not only clear the A beta plaques, but there's something like 20% slowing of cognitive loss. That the issue with it is, again, as I mentioned, this side effect when the antibody interacts with blood vessels or vasculature in the brain. This can cause swelling and brain bleeding. And it's not in all patients, it's a subset of patients, but that can lead to death. So it's a, you know, it's a pretty significant side effect. So that's something, if you are being treated now with lecanemab, it has to be done in a setting where they can monitor you for brain bleeding. So that's a little scary. But again, I think with targeted therapy where you're preventing this interactions with the blood vessels, and it's only eliminating the plaques in the brain. And I think we're getting there. Well, I am hopeful. And it, you know, it also suggests people, because of all these failed trials, a lot of people you know, said, oh, A beta, this plaque formation, it's nothing to do with disease. But the fact that giving this A beta immunotherapy, where you're getting rid of the plaques and it's improving cognition, I mean, it suggests that A beta does likely play a role in Alzheimer's. It may not be the only thing. There may be other things, tau, ApoE status, you know, how immunoaging builds
It's
up
a
in the
really
brain.
complicated question.
It's very complicated. But I
Mm.
actually have, I don't know, with the constant advent of all of these new scientific findings and technology, I think we are to a point where we can slow and maybe even reverse some of these age-related diseases. I don't think we're quite there yet, but I think we've gleaned a lot of clues. And I think a lot of this is going to be based on personalized medicine. It's going to be based on understanding what your genetic makeup is, your risk factors, looking towards your lifestyle, targeted therapeutics that can eliminate off-target effects. But we've had, and I will say I am in charge of, or one of the people in charge of the PhD program at the Buck, and I see there's just a growing number of amazing young scientists that are entering the field and very interested in the challenge that aging and age-related diseases
It also set
present.
for us new hope for the promising future of the
Oh
aging
yes,
area.
great hope for the future. I definitely, and I'm a bit biased, but I definitely think curing aging and age-related disease is really the next major scientific frontier. Really exciting, the breadth of, so I feel like as part of this group of scientists, my interest may lie with particular diseases, but I think findings are likely to have implications across a lot of these different age-related disorders. So very excited.
I quite agree with you on that. This is also the goal and our detection of the timelines is that we hope whole body of the human beings can aging slow, living well.
Yeah, absolutely. No, this is a wonderful thing you're doing. It looks like you have a enormous audience, and yeah, I love doing science. It's wonderful.
And maybe we come to the last one question. Before we prevent or before we began to treat diseases, what tests can be done to learn early about the neurologic aging? Through some games or any activities or detections in the hospital?
Yeah, I mean, there certainly are, for genetic forms of these disorders, there certainly are genetic tests, but also, there are behavioral or motor tests that can be run at, really in a way as part of like an annual physical. I think as I've gotten older, I think I am a lot more diligent about making sure that I keep track of markers of good, so I keep track of my blood pressure and my cholesterol and my blood glucose, all of those things. I think it's important for all of us as individuals to really take charge of our own health and insist that we have these tests run. So I think that's one of the most important things you can do for yourself and your health.
And looking ahead for the future, do you believe that aging can be reversed, or can the Alzheimer's diseases and other age-related neurodegenerative
I
diseases
mean, I
be
think we are
reversed?
getting to this place. So we start with kind of prevention, or we start at places where if you catch it early, but I think we are getting to a place where it's not outside of the realms of possibility with this the exponential progression of new scientific discoveries. I think it is entirely possible that we will get to a place where we will be able to review. I hope. That's the great hope of the field. So
We're also looking forward the bright future of that.
yes, that's right. Yeah.